chapter 14. Where the immune system can protect our body. However, immune system also have two side. It's a two-sided coin because it has so it has the benefit effect on us. However, it can cause harm to our body. So once the immune response causes harm to our body, so that is referred as the abnormal immune response. So this response contains the asthma, anaphylaxis, for example, asthma, anaphylaxis, diabetes, rheumatoid arthritis. So they are all the disease induced by the abnormal immune response. So the immune response, when we talk about the abnormal immune response, so that's the immune pathology, okay, because it can induce disease to us. So either the immune pathology is either over immune response, so that's referred as hypersensitivity, or the lower immune response, so that's referred as the hyposensitivity. So this is now let's talk about the over hypersensitivity. So hypersensitivity is classified as 4 types. So here we can see from type 1 to type 4. So here is the hypersensitivity. Here is the hyposensitivity. So hyposensitivity means the immune response is very weak, so it can induce the infections to us. Now let's talk about the hypersensitivity. So we have 4 types. Type 1 is the allergy and anaphylaxis. Type 2 is the IgG and IgM mediated cell damage. Type 3 is the immune complex. Type 4 is the T cell response. So for type 1, so this IgE mediated master cells, the basophil, and so these cells are involved in this reaction. So the example would be anaphylaxis, allergy, asthma. Type 2 is antibodies such as IgG, IgM mediated. So those antibodies can induce cell lysis, tissue destruction. The good example would be the pernicious anemia and myasthenia gravis. Type 3 is the immune complex, so this antibody-mediated inflammation. So the example would be the SLE, okay, rheumatoid arthritis, and serum sickness, rheumatic fever. Type 4 is the T cell mediated. So the example would be the contact dermatitis, graft rejection. So let's work on this question. Which of following is not a result of abnormal or undesired immune function? So I give you 5 seconds. Okay, so we can see A, B, C, D. All these are the immune abnormal immune response, immune function. Okay, so the D is the correct answer because D is the normal body defense regulator. Now let's talk about the type 1 allergy. So type 1 hypersensitivity allergy reaction. So allergy is what so in type 1 with in type 1 we can see the allergy. Okay, allergy so is referred as exaggerated immune response that is manifested by the inflammation. So the allergen is the substance that can induce allergy. Atopy means chronic local allergy, okay, such as high fever or asthma. Anaphylaxis is a systemic or even fatal reactions that involve airway obstruction and circulation collapse. So the allergy is very common. It's very common. So in America, so the most allergy are induced by the airborne allergens such as the pollen, dust, or mold. So type 1 allergy, so most of them are mild, okay? Even the asthma, so asthma is very common. However, most patients got the mild asthma or the food allergy, okay? However, some people with this disease can need the hospitalization because the symptoms are very severe. So the allergy actually can last for a very long time, even for the whole lifetime. So there is the genetic tendency to get the allergy. Okay, for example, some people may have the genetic background of have the increased IgE production, okay, increased reactivity of the master cells, also the increased susceptibility of the target tissues to the allergic mediator. So all these are the genetic tendency for the allergy. For example, if a child so if, for example, if the parents so if parents have the tendency to have allergies, so their children are most likely to get the allergy as well. So the scientists have studied on allergy and found that the industrialization also can play an important role in the allergy, because industrialization can produce more substance, more very tiny substance. So those substances actually can work as allergen to cause allergy. Scientists also found that if the children who live in the farm in the courtyard, so they have very low rate of the allergy. Also the C-section delivery and so the parents history of the allergy also can contribute to the high rate of allergy in the children. Studies have also shown that breastfeeding can decrease the rate of allergy because the breastfeeding actually can provide the baby all the nutrients and immune substance they need. Also, the breastfeeding can transfer the biota to the baby to set up the normal biota in the GI tract of the baby. So all these are the factors that can help the children and to decrease the rate of the allergen. Since allergen can induce allergies, so when we study the allergens, so it's best to study the allergen as well. So more complex the structure of the substance, the more likely these can induce allergy. For example, protein have complex structure, so compared to the carbohydrate and fat, so most organic allergens are the proteins. Some allergens are the heptane, heptane. So those are the small substance that can enhance the so that can be conjugated with other substances and induce the allergy. Okay. So now scientists have found tons of organic and inorganic chemicals from our household products, so those can work as the heptane. So how do we get the allergen? No, we can get the allergen through our mouth, okay, through our skin. So that can cause the dermatitis. Actually, so our skin, so the interstitials of our skin contains the keratin. Keratin is very tight, hard materials, so that can prevent the pathogen getting into our body. However, we have many Brix glands and hair follicles, so all these can work as so all this can help the pathogen penetrate to our body. So we can get the allergen by breathing. Okay, so this is called inhalant, such as the pollen, dust, fungus spore. We can also eat the allergen. So this is referred as ingestion, such as food allergy. Or it can be injected, so the allergen can be injected to our body. So this is referred as the injector, such as bees venom and the all the medications, the vaccine that we received for the medical care. All we can touch the allergen, and the allergen causes the problem. So this is referred as the contactant, such as such as the dermatitis. Okay, when we touch the allergen, it causes the trouble on our skin. Now let's talk about the cells involved in the allergy. So many cells, so actually the master cells and the beta cells are the most cells, so are the important cells in this allergy. Okay, so all these cells exist in the connective tissue, but they also so they can be found in the lungs, skin, GI tract, and the genital urinary tract. So all these cells have the granules. Okay, so the granules contains all kinds of cytokines that can induce allergy. So the granules contains the histamine. Okay, so histamine can cause the allergy, can cause the contraction of the bronchi, and cause difficulty of the breathing, and also can cause vasodilation, and then can cause the skin rash. So this is called wear and flare reaction. It can also stimulate eosinophil to release the inflammatory cytokines. Bradykinin can also cause the small cells contraction, can cause the bronchial contraction, can dilate the arteries, increase the capillary permeability, and cause edema. Okay, serotonin can enhance histamine and bradykinase effect. Nicotine can induce small cell contraction, cause bronchi contraction, can increase vascular permeability. Prostaglandin also can enhance small cells contraction. So it can also stimulate uterine contraction during the delivery, can cause vasodilation, increase vascular permeability, bronchoconstriction. So we have all kinds of the pain medication over the counter. Also, all this pain medication actually can inhibit the prostaglandin effect. So it's widely used for the anti-inflammation treatment. So in this diagram, we can see the once the so the B blood so the BCS is activated, so BCS will accept the antigen from the T helper cells, and then so the BCS can differentiate it to the plasma cells. Plasma cells are the mature for the BCS to secrete the antibody. So those antibodies can link to the can catch the antigens and link to the mast cells or the basophil cells, cause the degranulation of the mast cells and the basal cells, and then release all the allergic cytokines. So these are the allergic responses, such as vasodilation, bronchoconstriction, also the headache. Okay, headache. High fever. High fever is very common. Okay, it's also known as allergic rhinitis. So this is seasonal reaction to inhale the pollens, mold, or the airborne allergen. So the target tissue is the respiratory membrane. Okay. So it can cause nasal contractions, sneeze, cough, or profuse mucus secretion, itchy, red, and tearing. Asthma is very common. So this is the respiratory disease with the difficulty of the breathing. So asthma is induced by the inhalant or the ingestion or the other route of the allergen. So the allergen acceptance. So the patient will have the laboured breath, okay, laboured breathing, or even worse. So the patient may have the respiratory failure, okay. So the patient will not get efficient respiratory, efficient expiration. So patient can die. So if we listen to the patient's chest, so we can also hear the rears. Okay, the rears are the clicking, bubbling sounds in the lungs. So the nicotine and the serotonin, so all these actually are the cytokines induce asthma. Atopic dermatitis, eczema. So this is very common. So this is also very common. So this is the skin allergic diseases. So it can be induced by either eating, breathing, or the contacting the allergen. So it's very common in the neonate in the baby. Okay, because the baby's skin are very sensitive. So once baby's skin contact with of the food or so so if the baby skin contact with the allergen, so it can cause the eczema on the baby. So the patient will have the dry, scaly, thickened skin. Or reddish skin. Okay. So it can be itching, painful. Food allergy. Food allergy. That means when we eat certain food, so those food cause allergy. Those food could be the peanuts, fish, especially the seafood. Okay, cow's milk, eggs, shellfish, and even soybean. So the patient will have the vomit, nausea, diarrhea, abdominal pain. Patient may also have the hives, rhinitis, asthma, and systemic anaphylaxis. So the food allergy is induced by the IgE and the degranulation of the mast cells. So so we have to pay attention to the patient who has the history of food allergy. So if we want to give the patient the vaccine, because so especially for the vaccine to prevent the virus infections, because many viruses actually are incubated in the eggs. Okay, so that means the vaccine may contain the egg components. So the egg components can induce allergy to our patient. Drug allergy. So that means the drug induce allergy. Because now we have tons of medications used in clinic. So actually, most of the medication can cause allergy. For example, the antibiotics such as penicillin or the sulfa drugs, aspirin, opiates, all these can induce allergy. Actually, many medications can work as a hypnotic to induce allergy. Anaphylaxis or the anaphylactic shock is a very severe allergy. So we have the cutaneous anaphylaxis. So the patient will have the skin rash, or the systemic anaphylaxis. So the patient may have the respiratory symptoms as the circulation and circulatory symptoms. So if patient have a systemic anaphylaxis, so we have to pay attention because the patient will have the severe symptoms, so that could be fatal. Okay, injection. So the injection of the allergen, such as bee sting, okay, or the injection of the medications, can also cause anaphylaxis. So how do we set up the diagnosis of allergy? So we can use the radioallergosorbent test. So those tests can measure the amount of the IgE, okay? Tryptase test to measure the tryptase. We can also make a blood smear to count the basophils, and eosinophils. The leukocyte histamine release test to measure the amount of histamine. Actually, all these tests, so we can do this test. However, it's not necessary. Okay, so we can set up the diagnosis based on the clinical symptoms. The most useful test is the skin test. So we can so this is invisible test. So we can either scratch or prick the allergen to the patient's skin and see what so we can see like this figure. So we can scratch the different allergens to the patient's skin. So if we see severe and flare reaction, so that means this substance can cause the allergy. Okay. However, so we can do this test. However, actually, in the clinic, normally the here providers don't do this because so if the patient have hypersensitivity to certain allergen, so that may cause systemic anaphylaxis, right? So normally, so if patient have the symptoms, so we can set up the diagnosis. So the treatment, we can use some medication to block the action of the master cells or the chemicals releasing. We can also do the desensitization. Okay, that means we give the patient small amount antigen to let the patient to let the mast cells release the cytokines, so the little by little. Okay, so we use this method to do the desensitization. Also, protect the patient from the allergen. Okay, for example, in the season, for the hay fever. Okay, so we can recommend the patient to wear the facial mask to decrease the inhaled allergen, to decrease the amount of inhaled allergen, so that we will decrease the allergy. So now let's work on this question. Which of following is not an IgE or mast cell mediated allergic condition? So I gave you 5 seconds. So the IgE and the mast cells mediated allergic condition. So this is type 1. Type 1. So let's see which is type 1 asthma. Yes, Food allergy, yes. Allergy, yes. Eczema, yes. So the correct answer is C. Okay, C. Systemic lupus erythematosus is not type 1. Now let's talk about type 2. Type 2 is antibodies induced the hypersensitivities. So the antibody would be the IgG and IgM. So the example would be the transfusion reaction and some type of autoimmunities. Autoantigens, that means different molecules in the same species, okay? For example, the blood type, okay, blood type. Blood type, so in humans we have the ABO blood type, okay? So the blood type is induced by the A antigen, B antigen, okay? Also the Rh antigen. Rh antigen, that means, so that's monkey antigen, okay? So that's rhesus monkey. However, 85% of humans have this antigen, 15% doesn't have. So if a patient has Rh antigen, so that's Rh positive. So this, so actually that's the dominant gene. Okay. So Rh blood type actually doesn't cause trouble to the adult. So it does cause trouble in the fetus. So it happened in the second pregnancy. So it happened in the Rh negative mother and Rh positive baby, okay, Rh positive fetus. So if the first pregnancy is Rh positive fetus, so once the mama deliver the baby, so the rupture of the placenta will cause the fetus blood get into the mama's circulation. Then the mother's so the mother's body will generate the antibodies to the Rh antigen. However, the first pregnancy is fine without any problem. However, so if the mama have second pregnancy with Rh positive fetus, so the anti-Rh antibodies can get into the baby's fetus circulation to cause hemolytic reaction of the baby red blood cells. So this is called as erythroblastosis fetalis. So the fetus can have severe anemia and jaundice. So we can see in this figure, okay. Actually, we can give the mama with the antibody. So the antibody to the antibody of we can give mama the antibody to the antibody of the Rh antigen to neutralize the anti-Rh antibody, and then so we can protect the second fetus. So the second fetus won't have any troubles. So the antibody medication is called RHO GAM. So we can inject this medication at 28 and 32 weeks, and immediately after delivery. So this means we have to give the mama 3 doses. Okay, 3 doses. So once we give the mama these 2 doses, actually RhoGAM can neutralize the anti-RH antibodies in the mammal's circulation. After birth, so the third dose will prevent the anti-RH antibody generation. Now let's work on this question. One is the wrong game shot need. So I give you 5 seconds. So the correct answer actually is D, okay? Rh negative mother and Rh positive fetus. Now let's talk about the type 3 hypersensitivities, immune complex. Immune complex, so that means the soluble antigen with antibodies can form the complex, immune complex and deposit to the tissues, cause the troubles. So the antigen antibody complex actually can float in the bloodstream and reach to the organs and deposit there. So both IgG and IgM can cause this complex. So the mechanism is that so the antigen antibody complex actually so once antigen and antibody complex form actually, so this is very huge molecules. These molecules have the complex structure, so it have very high capacity to induce allergy. So those once this complex float in the bloodstream, so it can reach to, so it can be deposited to the basement membrane of the tissues, and then so the neutrophils can so the neutrophils may recognize this complex as a foreign substance and send the and release the lysosomal granules to destroy this complex. So once this lysosomal granules destroy this complex, so they also destroy the tissues, so that cause the disease. The example would be the ulcer reaction and the serum sickness. So this is associated with passive immunization. So it's similar to the anaphylaxis. So actually, so IgG, IgM, IgA, and IgE all can all this can cause anaphylaxis. Now let's work on this question. Which of following antibody type is not involved serum sickness and ulcer reaction? So the correct answer is B, IgE, okay, IgE, because IgE is involved in the type 1. Now let's talk about the type 4 hypersensitivities. So this is serum-mediated reactions. Actually, this is T cells induce reactions. So once antigen get into our body, okay, so the T cells actually can recognize those antigens and induce the hypersensitivity. For example, when we do the tuberculin reaction, tuberculin reaction when we inject tuberculin in the skin. So the tuberculin is a foreign substance. So this is antigen. So the TCRs, so the THCRs actually can recognize this antigen and recruit macrophage, neutrophil, and all kinds of cells, eosinophils, migrated to the site of injection, cause skin bump. The second is contact dermatitis. So if we contact the poison ivy, poison oak, or the heptans in the household products, so all this actually can cause contact dermatitis. So actually, all this allergen can attract the TCRs, and TCRs use cytokines to recruit the macrophage lymphocyte and cause the skin rash. The organ transplantation is also another example of the type 4 hypersensitivity. So now, the organ transplantation is relatively common. So when we replace the patient's organs, actually, since those organs are from the other donors, so the immunologic background is different, so that may cause the rejection. So the immunologic background is defined by the MHC or the HRA class, okay, markers. So if the MHC markers are different, actually, once we replace the organs, so the recipient's immune cells will recognize those organ, so that organs MHC molecules. So the recipient's immune cells will consider the transplanted organs as the foreign body, so they will destroy the donor's tissue. So this is called the graft rejection. So we have two kinds of rejections. First is the host rejection of graft. So this is cytotoxic TCRs induced the hypersensitivities. So once the cytotoxic TCRs recognize the MHC markers, so it will release interleukin 2. Then the helper and helper TCRs and the cytotoxic TCRs will bind to the graft tissues and secrete the lymphokines and induce rejection. So this is happened within 2 weeks of the transplantation. So if we don't treat this rejection, so eventually, so the graft tissue will be killed, because it can cause because it can destroy the vessels of the graft organs and cause the problem of the vascular supply. Another is the graft rejection of host. So this happens when we do the bone marrow transplantation. Since we transplant, so so we transplant another person's bone marrow to the patient's bone marrow. So the donor's bone marrow actually contains a high volume of lymphocytes. So those lymphocytes actually, so once the lymphocytes get into the circulation system, so they can recognize the MHC markers of the recipients. So they can recognize the recipient's MHC markers, and since the MHC markers are different, so the donor's lymphocyte can consider the recipient's organs as the foreign bodies. So the lymphocyte induce the rejection and inflammation to attack the recipient's organs. So the patient may have the skin rash, skin rash, or even worse symptoms, and so the patient may have the organs failure. So we can see in this diagram, So this is a host against host injection of the graft. So the graft, so we have 4 types of graft. Autograft. Auto means we can so that means tissue transplantation actually. So that means we do the tissue transplantation in the patient. So we get one tissue from a patient's body and transplant to another side. Transplant to another side of the patient, of the same patient. So in this, actually there is no rejection for the autograft because the tissue, the tissue is same. Tissue is from the same patient. So the MHC molecules are same. So there is no difference of the immunity background. Second is autograft. Isograft means tissue from identical twins. So for twins actually, for twins, most of the immuno background actually are same. So the difference is very minimum. So for this case actually, so the rejection actually is very mild. It's very less. The third is allograft. Allograft means tissue transplantation happened between different individuals in the same species. Such as we can transplant the organs from donor A to the patient B. So all the A and B are the same species as the human. However, the organ is from the different individuals. So the MHC molecules are different. So we will get the rejections in this transplantation. Exograft means we get the tissue from different species. For example, we transplanted the organ from pig to the human. So there is a huge difference of the MHC molecules. So the rejection is very strong, and is very significant in the axial graph. So the transplantation is relatively common and useful treatment in the clinic. So now we can transplant the skin, liver, heart, kidney, artery, bone marrow, cornea. Okay. So we can get the organ from the live donor. Okay. Mostly from the recent died patient or the fetal tissues. We also do the bone marrow transplantation. So we use the bone marrow transplantation to treat the patient with the leukemia, aplastic anemia, and other cancers. So first, the patient had to get the chemotherapy or the irradiation to destroy their own blood cells, their own hematopoietic stem cells. Actually, to destroy all the hematopoietic stem cells in their bone marrow, and then so we can do the match of the patient's MHC markers with the donor's MHC markers. So we choose the closest. So we choose the most close which are most close the so we choose the donor's organs with the most close immunity backgrounds. So the rejection can still happen. Okay, so normally we use the anti-rejection medication to protect the graft organs. So after transplantation, so the recipient's blood type may change to the donor's blood type. Now let's do this match. Okay, so I gave you 5 seconds. So we can see the autograph is the graph within an individual. Okay, like xenograph is between different species. Isograph is actually between the twins. Allograph means between so allograph is from different individuals. So the isograph is from the twins. So that's a graph between the twins. Now let's talk about the autoimmune disease. Autoimmune disease actually that means so the immune system actually attacks the attacked the organs. So attacked the organs in the same individual. Okay. So actually this this is hypersensitivity. It's a hypersensitivity. Since this hypersensitivity is we have different diseases. Some diseases are induced by the type 3. some are induced by the multiple hypersensitivity, such as hematopoietic. So the rheumatoid arthritis is actually induced by the type 2, 3, and 4 hypersensitivities. So most of them are the systemic reactions. One or more organs are involved in this disease. So the mechanism of autoimmune disease actually is the molecular mimicry. Okay, mimicry. That means due to some reasons, so the antigens has changed. Okay, has changed. So the immune cells recognize the host antigen as the foreign antigen and initiates so the initial attack causes the problem. For example, the microbe antigens actually can some microbe antigens are similar to the human cells antigens. So once we get infections, so those microbe antigens will attach to our human tissue and induce autoimmune disease. For example, psoriasis. So the psoriasis often happened after the strep throat infections. So that may be strep antigens is similar to the skin tissues antigens and induce the T cells rejection to the keratin in the skin. Now let's talk about the systemic lupus erythematosus. This is also referred as SLE. So this is actually it's relatively common in the clinic. So the patient has the butterfly rash on the cheek. Okay. So the patient may also have the symptoms of multiple organs such as kidney, liver, vessels. Actually, so the SLE is induced by the autoantibodies deposited to the tissues. So the real cause is not clear yet. However, the physician believes that the viral infections are the major cause because so the viral infections induce antibodies generated by our body, and so the virus particles bind with those antibodies to form the antigen-antibody complex, cause a problem. Rheumatoid arthritis. The patient will have the progressive debilitating damage to the joints. Patient also have symptoms of the lungs, eyes, the skin, and the nervous system. So the autoantibodies can form the immune complex and bind to the synovial membrane of the joints and cause the immune cells initiate the attack. So once the joint is destroyed, so the scar may form, the scar tissue may form, and cause the joint destruction. So here is the figure of the SCRE. We can see the butterfly shape of the skin rash on the cheeks. So this is the rheumatoid arthritis. We can see, so the deformation of the hands joints. Graves' disease, actually, so the auto antibodies are deposited to the receptors on the thyroxine secreting follicle cells. However, these antibodies, antibodies complex doesn't induce the destruction of the cells. However, they work as a stimulant to the cells to induce the cells to secrete more and more thyroid hormones. So the patient will have the hypothyroidism. Type 1 diabetes. So this is also the molecular mimicry. So the substance. So the foreign antigens is similar to the beta cells antigens, and when this substance attached to the beta cells, then the cytotoxic T cells can attack the beta cells in the pancreas and to kill the beta cells. So because we know the beta cells secrete the insulin, so the insulin level in this patient is very low. Myasthenia gravis, actually the autoantibodies bind to the acetylcholine gated ion channel on the sarcolemma. Okay, and then so the acetylcholine gated ion channel are destroyed because as we know, so the acetylcholine ion channel can induce the antiplate potential, can be so it's involved in the muscle contraction. So once the acetylcholine gated ion channel are destroyed, so the patient will not. So the patient cannot generate the muscle contraction. So the patient will have the patient will have the muscle weakness. Eventually, patient will have the paralysis. Multiple sclerosis, actually. So this paralyzing neuromuscular disease. So the TCS and autoantibodies attacked to the myelin sheath on the neuroaxon. Okay. So the myelin sheath is a very important structure to help the nervous action potential travel. Okay. So if this structure is destroyed, so it's difficult for the nervous impulse to be transmitted. Okay. So the patient will have the muscle weakness, tremors. So if the paralysis continue to develop, so it can cause the difficulty of the speech. So if all the nerves related to the pharynx and the larynx. So if the neurons really innervated the larynx pharynx are involved, so the patient will have the difficulty of speech or even the vision. So multiple sclerosis is associated with the human herpes 6. The treatment would be the immunosuppressant, okay, and interferon beta. Autoimmunity are caused by. So I gave you 5 seconds. So the genetic predisposition, X chromosome inactivation in females, molecular mimicry, viral infections. Actually, so all these are the causes of the autoimmunity. Now let's talk about the immunodeficiency. Immunodeficiency means the hyposensitivity of the immune reactions. So the immunodeficiency will cause, since the major task of the immune response is to defend the infections. Okay, so the immunodeficiency will cause the infections. So we have the primary immunodeficiency and the secondary immunodeficiency. So the primary means the patient will get the immunodeficiency at birth. Okay, so that means so this is the problem induced by the genetic error. Secondary immunodeficiency is induced the nature of the artificial agent, such as infections or the medications. So if so the immune deficiency can be induced by the BCS defect. Okay, BCS defect. Since the BCS produces antibodies, so if the patient have the BCS defect, the patient will have the very low level of gamma globulin. So this is called gamma globulinemia. Okay. So gamma means the patient will have very low level of gamma globulin. It's almost nothing there. Hypogammaglobulinemia, that means the level of gamma globulin is very low. Or the selective immunoglobulin deficiency. TCL deficient actually, so that means the TCL's the number of functions will get the trouble. So we have the systemic aplasia, digeorge symptoms. Combined BCS DCS defects. So if a patient have both BCS and TCL defects, so the patient will have severe combined immune deficiency and the adenosine deaminase deficiency. Complement defect. So patient will not have the complements. For example, the hereditary angioedema. So this is the example of the complement defects. Now let's talk about the secondary immunodeficiency. So the patient will get this either from infections, nutrients deficiency, stress, pregnancy, or aging. Okay, or from the artificial agents such as radiation, bone steroids, medications, immunosuppressive medications, or removal of spleen. Primary immunodeficiency, that means so the patients have the genetic errors that cause this problem. So patient will have this when they were born. Okay. So the patient, so this is the inherited problem. Okay, inherited problem. So the patient will have the abnormality of the lymphocytes. Okay, either B or T cells. So we can see this diagram shows that B cells and T cells are from the stem cells in the bone marrow, and then the B cells will be matured in the bone marrow, and the T cells will be matured in the thymus. So the B cells will make the antibodies to fight against the bacteria, and T cells will induce cell-mediated immunity to fight against the protozoa, fungi, and the viruses. So the BCS defect will have the immunoglobulin problem. So if the gamma immunoglobulin level is almost so it's almost gone, so it's called gamma globulin anemia. Okay, so if the level is very low, so this is called hypogamma globulin anemia. So the IgA deficiency is the most common. Okay. So for this case, so the patient may have the normal amount of the BCS. However, so when we measure the immunoglobulin, how immunoglobulin level is very low. So the patient may have the infections of bacteria, either in the respiratory tract or in the GI tract. So if a patient have the T cells defect, so the patient will have the opportunistic infections, cancers, or the so the patient's symptoms actually are worse than the patient with the BCS defect. The example would be the diagnosis symptom. So since the patient has aplasia of the thymus, so that means the T cells don't have the place to be matured. Okay, so the patient will not have the matured T cells. So that's why the patient will have the T cell defect. The patient may have the fungi, protozoa, or virus infections, also the cancers. Okay. So severe combined immunodeficiency. So the most so for this case, actually the most so the cause would be the genetic error. Okay, so the patient will not have enough of the lymphocyte stem cell. So that's why the patient will have both B and T cells defect. So the patient with this may have the candidiasis, fungus infections, sepsis, pneumonia, or viral infections. And so actually, so all these infections are very severe, so patient may get die. Okay. So if we detect the patient's blood smear, we can see the patient have very low number of lymphocytes, both B and T cells. adenosine deaminase deficiency. So because this deaminase actually is enzyme, so this enzyme is involved in the metabolic process of the cells. Okay, so if the cell have this problem, so the lymphocytes will develop, so lymphocytes can still develop, however, so they have metabolic issues, and eventually the lymphocyte cell will be destroyed. So the SCID patient requires a septic technique to isolate them from the microorganism in the environment. For example, patient is called David Vetter. Okay, David Vetter had this problem, so he needed to live in a steroid plastic bubble during his whole lifetime. Okay. So now we have several treatments can treat this disease. For example, we can do the stem cell transplantation. Okay, fetal liver transplantation. So the adenosine deaminase deficiency, if patient have this disease, we can do the gene therapy. Okay, to insert this gene to the patient. A secondary immune deficiency disease is caused by the infections, chemotherapy, radiation. The most common secondary immunodeficiency disease is AIDS. Okay, AIDS. So this is the virus. This is the virus so that attack the T helper cells. Okay, T helper cells, monocytes, macrophage, and antigen presenting cells. So especially the CD4 cells. So the patient will have very low number of the CD4 cells, CD4 T cells. So the patient has the problem of the immune response. So it's very easy for the patient to get the infections. So also the blood cancer also can destroy the lymphoid system, such as leukemia. Okay, leukemia is abnormal because leukemia is blood cancer. It generates tons of abnormal leukocytes. Actually, so those leukocytes are the immature leukocytes. So actually, it means those leukocytes don't have the function, so it cannot provide defense protection for us. Plasma cells tumor, so it can make tons of immature plasma cells. So those plasma cells secrete certain immunoglobulins, so cause the patient trouble. Okay. Thymus tumors can induce the T cells deficiency. So many drugs we take to prevent graft rejection actually can because those drugs actually inhibit the immune response, inhibit the immune response. So actually, it can cause the secondary immune deficiency disease as well. Radiation and chemotherapy can also kill the immune cells inhibit the immune response and cause secondary immune deficiency. Now let's work on this question. The most common deficiency in the immune globulin is, so I give you 5 seconds. So the correct answer is A, IgA deficiency. So this is appendix, so I recommend you guys use it for your reviewing. This is the end.